Hello viewers, welcome back to another episode on male factor infertility. Today we're going to focus more on the recent advances in treating a man. There's so much that has happened with treating a female factor infertility, but unfortunately in the past there's very little that we could do with a man. But again, thanks to the advancing science and technology, and there's so much more that we can do with a man's sperm count and fertility potential. There are times where a man's sperm count is totally zero. It is called a nil sperm count or azoospermia, and in the past, probably 2 to 3 decades back, we said the only way such people, such couples would conceive is by usage of donor sperm, that is using somebody else's sperms, or they should have gone for adopting a child. Now no longer this particular concept is applicable because the technology is improved. So with people with zero sperm count, there are so many investigations, newer investigations that can be done to understand if there is a slight amount of production that's happening in the testis, and if there's any production happening, then we can do a small simple surgery called as testicular sperm aspiration. TISA is what it is called. It's a very simple surgery. It's just a needle prick, very little anesthesia. It hardly takes 5 minutes. You recover in half an hour and you're back to work the very next day. It's a very simple process. All that we do is we put a needle under anesthesia into the testis. We pull out the sperm cells. If there are good sperm cells, we can then offer a test tube baby process, that is an IVF-ICSI process, and help the couple to conceive. There are times where a biopsy is done and we don't get any sperm cells, and most of the times the men have been told that this is the end of your journey, unfortunately. Well, again, there's a hope for such people. There is a new advancement called as micro-TC. This is a micro dissection of your testes. All that we do is we open up a testis, we use a microscope, we go and we search the testis in different segments and lobes, and it does help us visualize the testis in a better way. And the areas which look normal, we go and take biopsies from these areas, and that increases your chance of finding sperms at a testicle level, which thereby will help us give a better success with an IVF-ICSI cycles. So friends, there's nothing like there's an end of the journey. You got to be exploring options. Talk to your doctor, get the right advice at the right time, and male infertility is always a treatable cause. Thank you so much for viewing our Hi9. Thank you.